So I'd like to welcome everybody to the community update for December the 29th. Welcome to this week's update. Merry Christmas and Happy Kwanzaa to those celebrating in our community this week. Our enforcement update is from December the 17th to the 27th and includes actions from our local enforcement partners. 11 tickets were issued over the 11-day period. 2 tickets issued by the Region of Waterloo Public Health for failing to obey a continued order. Both tickets were $880. Sushi Star Kitchener for exceeding capacity limit, and Pizza Roma in Waterloo for failing to ensure proper wearing of a face covering. 6 tickets were issued by the City of Kitchener bylaw at 2 residential properties for exceeding gathering limits. All tickets were $880. 5 of the charges were issued to people at the same address and gathering. 1 ticket issued by the City of Waterloo bylaw to 168 Sushi Waterloo for failing to obey a continued order exceeding capacity limit, and that was a ticket of $880. And 2 tickets issued by GRT Transit Security at the Ainsley Terminal for failure to wear a mask, and those are $240 fines. For those at home with children over the break, I hope you're able to get outside and enjoy the snow while we have it. Thank you to our healthcare, frontline, and essential service workers who continue to work hard for our community during the pandemic and specifically over the holidays. As this wraps up our last formal update for 2020, I wish all of you a healthy 2021. This week, there will be a lot of reflecting about 2020 and what it's meant for us as individuals and as a community. I hope in your reflection, you see the light at the end of a very long tunnel and the hope that comes with 2021. Our In This Together campaign reminds us to support and protect each other as we patiently watch the vaccine distribution, and we anticipate a ramp up of our local clinics and more doses from the province in the coming days and weeks. It's important to continue to be kind to yourself and to be kind to others. Our In This Together window signs can be downloaded from the region's website in 10 different languages, or use the hashtag BeKindWR on social media to share your stories of kindness and inspiration. I would now ask our Medical Officer of Health, Dr. Wang, for an update on the COVID-19 in our community.
Thank you, Chair Redman. Good morning, everyone. So regarding overall trends, case rates in Waterloo region remain high but stable. There was some lower testing volume over Christmas, so it is too early to say what the most recent numbers could be signaling. Our incidence rate is currently 92 cases per 100,000 per week. Our most recent reproductive number remains at 1.1. We continue to have outbreaks being declared in long-term care and retirement home facilities. Although we currently only have 8 workplace outbreaks, we are also monitoring a total of 135 workplaces where at least 1 employee has tested positive, 84 of which have 2 or more employees who have tested positive. This is our highest number of workplaces being monitored to date and is reflective of COVID being widespread in our community and therefore being commonly detected among people who work. So we must continue to follow public health measures to protect each other and to protect our healthcare system. On Saturday, Ontario entered a province-wide shutdown. We know this was needed to protect our healthcare system and help us flatten the curve, but we cannot rely on those measures alone. We also each have a role to play. By staying home, avoiding social gatherings, and by limiting the number of trips we make outside our homes, we are protecting family, friends, neighbors, and helping Waterloo region as a whole. If we do not give this virus the ability to spread easily from one person to another, we will start to slow the spread of COVID-19 in our community. We can do this. We can slow the spread of COVID-19 in Waterloo Region and emerge from the province-wide shutdown in a better place. In closing, this year has been like no other. It has been a very difficult and challenging year for our community. Despite these challenges, I am grateful for the hard work, care, and resilience that so many in Waterloo Region have shown throughout the year. I would like to thank our many healthcare and community partners for the incredible work they are doing each and every day. Our community partnerships have been invaluable. I am grateful for the efforts of so many residents who have been doing what they can to adhere to public health recommendations, and this for a very long time, including more recently foregoing traditions and celebrations this time of year. I am also thankful for the many in our community who, through acts of kindness, are helping each other through these difficult times in ways that are not known to the general public. And last but not least, I am grateful to our public health, paramedic services teams, and regional staff who have worked tirelessly to support our community this year and provide the very best service they can. It is an immense effort to care for and protect our community, and I am grateful for all that you have done and will continue to do. I wish everyone a safe and happy New Year. Thank you.
Thank you, Dr. Wang. And now we'll get an update on the vaccine rollout from Deputy Hilton.
Thank you, Chair Redman. Good morning. The Vaccine Distribution Task Force continues to meet regularly and takes its lead from the Provincial Task Force. To date, we've held 3 clinics and have administered approximately 230 vaccines. Scheduling dates and times of the clinics in Waterloo Region were decided on following direction from the Ministry of Health while ensuring stability of healthcare resources for residents over the holidays. This week, the clinics are expected to vaccinate 300 to 400 people per day. We have now been informed by the ministry that sites should continue holding clinics using their full number of received doses rather than holding back the second dose, while also planning to ensure adequate inventory of second doses at the 21-day mark. We anticipate another vaccine shipment next week and will continue to prioritize long-term care staff and high-risk retirement home staff, in addition to essential caregivers from both settings. Where there are clinics spots that cannot be filled or unused spots at the end of the day, doses will be allocated to high-risk hospital staff. I am immensely proud of all of those who have been working in the clinics, as well as those working behind the scenes who were able to mobilize so quickly with the early arrival of the vaccine to ensure we were able to run clinics prior to Christmas. A tremendous amount of work has been done and will continue to be done as we move forward with scheduling of more clinics. Moving forward, we will align our clinic operations with the availability of the vaccine, priority populations to receive the vaccine, and all staff required to run the clinics. I also want to remind the public that although a vaccine is an important step towards recovery, safe distribution to the general public will take time. Along with your patients, we ask that the community continue to follow public guidelines. Thank you.
Thank you, Deputy Hilton. We'll now go to media questions. Joanna, do you have a question?
Yeah, for Deputy Hilton. Can you just explain to me more? You were talking about administering all the doses and then the second dose. Can you just explain more what you mean by that, like how it's going to be done?
Sure, and I may ask Dr. Wang to jump in and assist me here. So our first information was once we received the vaccines, so to hold back, being that it's a 2 vaccine process. So to hold back the second vaccine once the person was originally vaccinated, so that within 21 days, we knew we had the supply for that second dose. So we've now learned through the ministry with some regular vaccines coming to the different clinics, that the ministry is now suggesting we use all the vaccines because we are being assured that we will have that 21-day second dose for everyone who is being vaccinated. So initially it was holding back to make sure that we had the dose, the second dose from the same batch, but we're being assured that with the vaccine rollout that we will have that. So we can now accelerate the vaccine process and have more people being vaccinated.
Dr. Wang, sorry, do you want to add to it? Oh, you're on
Sorry,
mute.
Deputy Hilton explained. Sorry about that. Yeah, Deputy Hilton explained it perfectly.
Okay.
So I don't have anything to add. It's really just that. It's good news that we have a more stable supply, or we're more assured now of a more stable supply of Pfizer vaccine, and so we can start to distribute more doses to more people because we know there will be second doses coming for those that have already received the first dose, so we don't have to hold back those second doses anymore.
Joanna, do you have a supplemental?
Yeah, sorry, I think you mentioned that 3 clinics had been held already. I guess just wondering, like, does it take a lot of staffing to run these clinics? Or I think maybe the general public might have thought once we have the vaccine, you know, we're going to just like hold tons of clinics and just get all the shots given as quickly as possible.
Deputy Hilton?
Thank you. So with it, we held the 3 clinics. So we have to work with the space that we have as well to allow for pre-screening, to allow for COVID restrictions and distancing. In addition to setting up, I do believe that we have site or spots for 10 vaccinators, but I may be incorrect with that number. But again, it's using the location that we have because of where the freezers are and where the vaccines are to be able to run the clinic in that particular space.
Yeah, I would just add, we were following provincial direction and also, you know, needing to ensure that we had enough staffing, both, you know, in the care homes as well as the hospitals during the holiday times. So we now have received direction though to, you know, just continue holding the clinics and we will be ramping up clinics in the region as a result of that. And the good news about you know, more supply of vaccine coming to us in January.
Okay, Krista, do you have a question?
Yes, I do. Thank you very much. Let me just pull up my email here. Do we know exactly how many vaccinations were given out between December 24th and December 28th?
Who wants to answer? Deputy Hilton, do you know that? Or
Yeah, you're talking locally, correct?
Correct.
So I do believe it was 230, approximately 230.
That was the 230. Okay.
Krista, do you have a supplemental?
I do, yes. I have a question about the enforcement as well. You had mentioned the homes and the businesses. Have we seen any enforcement regarding Toboggan Hills in our area, or any calls regarding that?
Not to my knowledge. Again, it's outside. We're asking people to physically distance. And I know from my grandkids' experience, they wanted to go early so that the hills weren't overly populated. But to my knowledge, there have been no tickets issued at any of those locations.
Okay. And when we talk about the amount of vaccines that are coming, I'm sorry, I lost my quote here, one moment. The 300 to 400 people per day. Have we heard anything about the Moderna coming to town, or what time or what date that may appear for us?
Deputy Hilton?
At this stage, we have not heard locally about the Moderna vaccine coming to Waterloo region. We're waiting to hear, but we haven't heard any confirmation yet. Unless Dr. Wang has heard something different than me.
No, we're gonna continue to plan though, in anticipation that it may come. It's anticipated that initially it will be small volumes, and it may take a little while for the supply to be more guaranteed, like the Pfizer vaccine. Can't speak this morning, but we're readying our plans anyways, so that we can start to deliver soon after we've received the doses, when we receive them.
Okay, Ben, do you have a question?
I do. This is a question for Deputy Hilton. Just regarding the vaccine rollout, and I know you kind of addressed this with the saying that we took provincial direction as far as the clinics go over the holidays and that whole snafu. I'm just wondering, were we able to give any feedback on that, or did we just kind of take direction and also pause our clinics?
Deputy Hilton, do you want to answer that?
Sure. Sorry, I couldn't find my mute button. It seems to be the thing we say here. In terms of the clinics, yes. So we did go by the provincial guidelines on the clinics when they were open and how long they were open. So as you're aware, that has changed, and we're ramping things up based on what the province has just advised us as well. Running clinics, hoping to run them and planning to run them 7 days a week, so that we can now, with the known number of vaccines and knowing that we do have more coming, that we can actually vaccinate more people. So I think it was just the original planning. We weren't sure around supply. And so now that we know that we have the supply, we're able to ramp up some of our vaccination clinics or clinic.
Dr.
Okay,
Wang,
so
wanna
when
add-
we were,
Sorry,
I'm
Ben.
sorry, just when we were given the instruction then over the holidays to pause those clinics, did we give any feedback on that, or did we just kind of follow that direction?
I'm not sure if there was feedback provided in terms of, I think we were just following our direction based on what we knew at the time. So I'm sorry, I apologize. You did ask that initially. So in terms of us as a task force providing any feedback on clinic operations, I think we had some conversation around what that looks like based on staffing and what it looks like for planning to get people in for vaccinations. And then, but quite frankly, we just followed what was provided.
Ben, do you have a supplemental?
Yeah, I know Deputy Hilton, you also mentioned moving forward, we're going to align clinic options with availability of the vaccine and staff to run those clinics. Are you saying that we will more be basing it off that rather than provincial direction going forward, or would it still be kind of the same situation where if the province said you need to close these clinics, we would follow that?
Yeah, so we are following the guidelines. So the province has indicated to run clinics 7 days a week, to ramp it up, knowing that we do have the vaccine availability. So that's why we're changing our schedule to be consistent with what the province is directing us to do.
Dr. Wang, do you want to add to that?
Yeah, just confirm that the province has changed now its direction, and its direction now is to run them every day.
Okay, in the chat box, Hala from CBC is going to use her phone line. Hala, do you have a question?
Are you able to type it if you're not able to?
Yeah, Hala, can you either unmute or type your question in the chat box? Okay, maybe we'll come back to Hala. Does anyone else have another question? Joanna, go ahead.
Yeah, the province is reporting like a running tally of how many people have been vaccinated. Is that something the region would consider perhaps putting on the dashboard?
Who'd like to take that one?
Well, there is a COVID-19 vaccine distribution task force page, and I'm sure the information that we're providing at these press conferences on a weekly basis, we can post that information there. It would have the numbers like Deputy Hilton has provided this morning. Sorry, I kind of.
That sounds like a
dashboard. Dashboard is something we maintain. Is that okay? Yeah.
Krista or Ben, do you have a question? Krista, go ahead.
Yes, please. I have a question just to follow up on Ben's suggestions from the province. They had also stated this morning in their press conference that they will no longer be closing for any days. So will the region of Waterloo keep these clinics open for our upcoming stat for New Year's?
Deputy Hilton?
Yes, thank you. I know our planning committee is looking at aligning with the province in terms of January 1st and any of the holidays to continue with the clinics being open. So yes, we will align.
Okay, and I have one more question if that's all right as well.
Sure.
Dr. Wang, I believe it was yourself who had mentioned the workplace. We are seeing an increase in cases in workplaces. Can you just clarify what sort of settings is that? Are those office settings? And why do you think we're seeing more numbers here? Is there too many people? Are we not following the rules, or how can we fix this?
Oh, thanks for the question. I really wanted to illustrate that from time to time, I do provide numbers about, not only where we've detected workplace outbreaks, that is where we think there's been transmission that could have reasonably occurred in the workplace, because sometimes workers get it outside of the workplace, but because they work, they are cases in a workplace. To illustrate really that spread of COVID is broad across our community. And when you have settings that are opened, well, you will naturally find more cases among people who frequent those settings, like workplaces. And so it really was to help illustrate that, we still have a high number of cases, although at this time our trends seem to have stabilized in the short term, which is always good. But it just continues to illustrate that we have a high number of cases. And in terms of the workplaces that are affected, it is all kinds of workplaces. So if you take a look at our dashboard, you'll see that we have outbreaks reflected in various settings, and it's the same thing for workplaces that have at least one worker that has gotten COVID. It's across all workplace settings, and so they're really issues come up when in workplace settings employees or patrons don't follow the precautions. And the trends that we've seen in workplaces so far is it tends to be the large majority of the time when we see spread in the workplace, it tends to be from employee to employee, and it tends to happen in areas of the workplace that are employee only. When, for example, they take breaks or they're on lunch or they carpool together and they, don't take the precautions that's recommended. They remove their masks, they are within 6 feet of each other. That is by far the most frequent circumstance under which we see spread occur. So it's workplaces are also doing a lot in terms of the precautions they put in place to prevent spread in their settings. So, we rarely see worker to patron spread, but we see a lot of worker to worker spread in those worker only environments. So that's really the key takeaway, is that we have to, with this virus, we have to be cautious all the time. We have to keep up those precautions, not only in areas where patrons can be, but also in areas where there are only workers. That's really what those stats are meant to illustrate.
Are you expecting those workplace numbers then to go down now that we are officially in lockdown, or what is your suggestion to businesses?
Yes, no, that's the hope. That's the hope, that with the provincial wide shutdown, that we'll have less interactions, because there will be less activity in businesses, in schools, etc. And we're asking people also, right, to stay at home and not gather with others. So overall, there will be a lowering of activity, and this should help bring the spread down, and then lower the number of times that workers get infected with COVID. Yeah.
So Ben, did you have another question?
Yeah, just another follow-up on the vaccine pause that happened over the holidays for Deputy Hilton. I'm just kind of wondering what the conversation looked like with the local task force when we were told that we'd be pausing a couple days. Was there any concern that this wasn't the best approach?
Deputy Hilton?
Thank you. I don't think there was any concern. I mean, we had already with the planning committee, if you remember, and I think I spoke about this a bit earlier as well, with the planning committee, our first shipment, we believed, was coming on the 23rd of December, and we actually got it early on the 21st. So part of the planning was all around that first date initially. And then my second favorite word is we pivoted very quickly, the planning committee, around now planning for vaccination, because it came early. So there was a lot of planning. We'd already received direction from the province to not vaccinate during the holidays as well, to shut clinics down. So we had some fairly, we had direction and guidelines provided to us. So the discussion wasn't around whether we should be open or shouldn't. This was what was provided to us. And then also, to go back to the planning part of it, this is how we were able to plan, is knowing when the clinics were operating and what days we were operating as well.
Okay. So I know this is it's been described as a paramilitary operation, and I know it's kind of a logistical nightmare. So I would understand just taking direction and going with it. Is there any kind of process for feedback if there are any red flags in the future, like maybe we should be doing it this way, maybe we should be doing this, or is it all up to the province?
Oh no, definitely there is opportunity for feedback. We're all learning as we go, considering that, yes, we have blueprints in place for vaccination and vaccination clinics, but with the really quick rollout of this particular vaccine, and knowing that it is for priority populations, etc., that we were going with what was provided. But as the clinics are occurring, there's opportunity for feedbacks at different tables that are, for instance, that Dr. Wang might sit at, or Grand River Hospital might sit at, to provide feedback to the ministry to say what is working well, what are some of the hurdles, how can we get past this, what might work differently as we move forward. So there's definitely always opportunity for feedback. And as I said just a moment ago, we are really operating on very quickly to mobilize this. So I expect that we will continue to not only advance what we're doing, but to get better at what we're doing.
Dr. Wang, did you want to add to that answer?
No, except to highlight that, yeah, sometimes the information changes by the hour, and we have to pivot, as Deputy Hilton said, which is sometimes challenging, although the teams that have been working on it have been able to do it really well. There's also it's not just the teams that are working on scheduling and staffing up the clinics. There's also the care homes that we have to ensure that they're able to have their staff come, and even when we change dates, and they're working really hard. It's difficult for them too, because sometimes the dates change. If we think we're going to get the vaccine this day versus another day, and then it ends up even other day, then the homes have to also pivot with us. So, I think it's safe to say that the province has received the message about the clinics, and that going forward, the direction is to ramp up, and we have forums that staff in running these clinics are able to provide feedback up to the province, and yeah, we will use those forums going forward.
And Ben, to sort of the nub of your question, I sit on the vaccine committee, and I would have to tell you that everybody on that committee represents a team of people. And when we have our touch points, which often are daily, but not always, I am so impressed with the constant telephone conversations that not only the representatives on the overall team, but all of their teams who report to them are doing. So there is a constant flow of information. And sometimes things evolve, as Deputy Hilton said, almost hour by hour, but there's a constant contact between team members in the province and the ministries dealing with this. I'm going to let Hala try again to see. Hala, do you want to see if you can ask the question? And if not, you can type it in.
Yeah, can you guys hear me?
Yes, we can. Go ahead.
Awesome. I'm really sorry about that. So I just want, this is just a point of clarification. Is it 230 vaccines administered since the vaccine arrived to Waterloo region?
Yes, that's correct.
Okay, and do you mind just elaborating on the immunization clinics, kind of where they or will be located?
I'm sorry, you're asking where the clinic is located?
Just more information on those clinics.
So we have one clinic in Waterloo region, and that's located at Grand River Hospital.
Yeah, Helen, just you may already know this, so sorry if this is a repeat, but the province has specifically identified the sites, and one of the sites in the province is Grand River Hospital. It can only go to that site for now, because the vaccine needs to be delivered at the site where it is. The vaccine needs to be administered at the site where it is delivered, due to the limitations associated with movement of the Pfizer vaccine. So it's just Grand River Hospital for now.
Okay, thank you for that clarification.
Thank you. Are there any further questions? Joanna, go ahead.
Yeah, a question for Dr. Wang about the outbreak at Cambridge Country Manor. Are you concerned about the scope of that, or do you feel like enough is being done to manage it?
Yeah, no, it's very concerning. It's a pretty big outbreak. I do get updates from Cambridge Memorial Hospital, which is overseeing the outbreak, and their teams and the staff of Cambridge Country Manor, I know, are working incredibly hard to slow the spread. And I think in recent days, we have started to see some signs of spread starting to slow. Unfortunately, the spread had occurred very quickly, and a very large number of people had been infected, including a number of deaths. So my sense is the outbreak is starting to come under control, and I think it's due to the work of Cambridge Memorial Hospital and the staff at the home. These can be very, very difficult outbreaks. to control once spread has occurred. And oftentimes, because we're doing a lot of testing, whole home testing, repeating it often, we are going to see when there's been spread, very high numbers, and those numbers climb for a while before we start to see the increase in the numbers slow down. So what we've seen so far for that home is very reflective of the fact that spread occurred very quickly and very quickly and broadly initially, and now we're starting to see that the effects of the measures that have been put in place are starting to have an effect. So I'm encouraged by that, and we'll continue to monitor.
Okay, Ben, you had another question?
Yeah, just a quick follow-up clarification here. I'm just wondering when we were told by the province that we'd be pausing for the holidays, because I know you said it changes by the hour. I'm just wondering if we know when about said information came in.
I don't know.
Sorry, Dr. Wang, I don't have an exact date, but certainly prior to the holidays, we were advised dates in which the clinic would be closed. So I don't have an exact time for you. Dr. Wang, do you remember?
No, I don't remember. I just know this was a provincial direction given to all the sites.
Do we know, like, if it was like roughly a week before, 2 weeks, shorter than that?
Oh,
well, certainly wouldn't have been 2 weeks, considering we've not been up and running for 2 weeks. So I think again, Ben, I'd be guessing if I said it was last week, but certainly just prior to the holidays, we knew what our clinic operation hours would be over the holidays, and that was by what the province had provided.
And Ben, you may have also heard, but the province did provide a little bit of information about the fact that they made that decision in large part because they understood that staffing in the homes, in the long-term care homes, would be reduced over the holiday season. As you know, there are already challenges with staffing in care homes in general. And so, there was concern about the ability to ensure appropriate balance between enough staff being able to care for residents in the homes, as well as being asked to go to immunization clinics. So this was a provincial decision, and it was based on what we've heard from the province. Was in large part also based on the fact that they had to try to balance the availability of staffing to keep the health system stable, but they have since, as we now know, pivoted. There were some challenges with staffing in the homes overall in the province, and that was why there was that decision. But going forward, we've received the direction now. We're going to execute on it, in which we're just going to immunize as much as possible going forward.
Yeah, he said no more days off.
Yeah, that's correct.
Thank you. If you believe it, that's all my questions on that.
Krista, did you have a final question?
Yes, I do, please. Regarding the enforcement, you had said, Chair Redman, 6 tickets to 2 residential homes. How many calls did we get? Because I know that some people may have called in the snitch lines on their neighbors. Do we know how many calls were given?
I don't have that statistic in front of me, Krista, so I would be guessing. But I do know that there were many visits over the weekend. So enforcement was out, and there were some neighbors concerned about other neighbors.
Okay, and what's your reaction, I guess? Do you have any more information on the 5 tickets that were given to the one home, of how many people we think were in that home?
I don't, just that there were 5 charges issued to one address because it was in excess. So the homeowner, and then there would be additional tickets.
Okay, and was that like Christmas Eve, Christmas Day, or was this Boxing Day, like post lockdown?
It's between the 17th and the 27th, so it's that 10-day period.
Okay. All right. My last question for that is then, I guess, what is your reaction to people not following the rules around gatherings for the holidays? And do you think that this is going to impact our numbers?
I think it will impact our numbers. We all always know that there's a lag between whether or not people adhere, but I would have to tell you, as much as these tickets were given out, I can assure you there were a vast number more bylaw officers out inspecting and following up on concerns and complaints. So the vast majority of people in Waterloo Region continue to adhere to the public health guidelines. And I think it was Deputy Hilton that already made the point that, you know, it's great that the vaccine is here, but we still have to adhere to those public health guidelines. I think we all know them off by heart. We just need to continue to keep doing them. It was a very different Christmas for my immediate family, and I'm sure for everybody's. And we just have to practice patience so that when the vaccine is widely available, everybody who is willing to get it will get it, and then we can move forward to a post-pandemic world.
Okay, thank you.
Hala, I'm just going to go back to you. Do you have a question? Another question?
I should be okay. Thank you.
Okay. No more questions? Thank you all. Stay well. Thank you for continuing to be trusted partners. I don't have the number. They used to give me the number. I don't know how many community updates this makes, but it's many, and you're all starting to feel like it's just a regular occurrence. So thank you very much for continuing to keep our community informed in all these important issues, and wish everybody a peaceful and happy new year. And we'll all look forward to a better 2021. Thank you very much.